In this video, we're just going to do a bit of a deeper dive into the common bladder and bowel symptoms to look out for if you're living with a diagnosis of multiple sclerosis. Continence dysfunction is one of the many invisible symptoms of MS. And just like MS is different for everybody, everyone's bladder and bowel dysfunction can be different too, and new experiences can be different. There are, however, several common symptoms that are linked with neurogenic or nerve-related continence dysfunction that we often see and help with on a regular basis as our role as a MS healthcare professional. The most common set of symptoms that we see for MS bladder are the signs of neurogenic overactivity or overactive bladder. And these are mainly related to issues around storage of the urine. And this is when you have frequency, urgency, nocturia, so you have to get up many times up overnight, 3 or more times. And sometimes this is or isn't associated with leakage. The leakage is often related to the urgency. When you've got to go 5 seconds ago, and maybe for other functional reasons as well. You may have difficulty having the time and the capacity to get to a bathroom. It also might depend on where you are. Other common symptoms include issues with storage and emptying due to DSD. This is detrusor sphincter dysynergia, just a very fancy word for detrusor being the bladder muscle. Sphincter is the 2 valves that are needed in the urethra for continence and emptying, and dysynergia is just a fancy word for uncoordinated. And so the symptoms you have with DSD is that you have hesitant flow, so you're absolutely busting and you sit on the loo and not much happens, or you have stop-start flow or intermittent flow. It might take a long time on the loo as you stop and start and try to empty. You might have the sensation of incomplete emptying when you leave the bathroom, and that's really a sign of partial retention, or you are not emptying properly and some of it's left behind. And so you might do things like double void. I'm just going to try and push out a little bit more to see how I go. And it's also common in this set of symptoms as well to strain. So whether you're bearing down, pushing on your belly and leaning forward, or doing a bit of a wee dance to try and squish it out. The third set of possible symptoms is where the messages are not getting through at all, and you can end up with an underactive bladder. And this holds on to more urine than should be, and not much emptying is happening. So you rarely get the desire to void. In some cases, people don't have ever a desire to void, and they don't pee very often. They often leak without warning. And so this is a case where people may wake up wet without being woken up with that urgency feeling, or you might, again, during the day, just have spontaneous leaks without any warning. And also, again, you might have that sensation of incomplete emptying where there's not much coming out, but you feel like there's still stuff left over. For the bowel, the most common symptoms of bowel dysfunction in MS is constipation. And this is due to that slowing of the transit of the stool through the large intestine, things moving through. And it dries out too much because of the slow movement through the large intestine and becomes a bit of a brick, really. And then it becomes hard to empty. You can sometimes also experience what we call fecal overload, and that is often described by patients as 1 minute I'm constipated, the next day I've got diarrhea, and then I'm constipated again, and it flips very quickly between the two. This diarrhea is often sort of a yellow, mustardy kind of colour and often can be mucus-like. And what that actually is, it's actually a fluid or a lubricant that the lining of the rectum has created because it recognises that there's a blockage in there, and it creates this fluid to try and help the stool pass and help you become unblocked. And so it comes out very easily because you've got a hard thing in your rectum plus this lubricant sort of like fluid, and so that's why you feel like you're constipated, but you have these sort of watery things coming out of your bottom. So that is more to do with constipation. Not as often, but it can be seen. It has the opposite effect on the transit time, where it makes the transit time very quick, and so therefore the waste products in your large intestine doesn't have time for the water to be pulled, and so it remains a very watery product, and then you can get diarrhea from that and fecal leakage from that as well, or accidents. With both the bladder and bowel, there can also be issues with pelvic floor muscles and or the sphincters, and that can be related to MS or not. It's really important, worth considering the varying degrees of bother and how much your symptoms are bothering you, and also how significant the symptoms are and how severe and the impacts that they are having on your activities of daily work, of study, of life in general, and your quality of life. I think it's really important to understand there are very good and very effective management strategies out there that can significantly improve your comfort and your quality of life. It is possible to continue to live well with MS despite symptoms of bladder and bowel dysfunction, and the healthcare professionals are here to help you with that, with your understanding and what your strategies can be around that. Sometimes the symptoms are mild and need little or minor lifestyle considerations to manage them. Other times the symptoms may need input in an assessment and management strategies from a specialist such as a urologist or gastroenterologist to help you work out the best way to manage your degree and your symptoms. As it is with MS, things can evolve over time as well. For better, sometimes they get a little bit better, sometimes they get a little bit worse, or largely they can stay stable once they've been, once they've occurred. So with the regular follow-ups that you have living with MS with your healthcare professionals and your MS healthcare professionals and your GPs, we encourage you to keep them updated if anything changes, again, for the better or the worse. So we can keep an eye on things and just make sure, you have appropriate resources available to you. It's also important to remember there can also be other causes of bladder and bowel dysfunction that are not related to MS that may need to be considered. Whatever the cause, we encourage you to talk to your healthcare professional about your bladder and bowel problems so we can help you and help you understand the cause and find the appropriate management strategies for you. This is why it's so important to talk to your healthcare professionals if you're having any symptoms or concerns or just questions about bladder and bowel. Again, you can read more information about MS and how it affects your bladder and bowel in the patient booklet, Your Guide to Understanding Bladder and Bowel Wellness in MS, which can be found on the MS New Zealand website.